Hello, my name is Vladimir Hakome. Are you speaking about neurosyphilis and its complications? Neurosyphilis is a bacterial infection of the brain or spinal cord, as it usually occurs in people who have ham, herpes syphilis for many years. Neurosífilis is a clinical presentation of syphilis and can occur in the early or late stage of infection. Although specific treatment for clinical forms of syphilis have existed for a long time. The advanced stages of the disease are still prevalent. For example, Treponema pallidum. The bacterium Treponema pallidum causes infection by penetrating the skin or mucous membranes while solution of contain solid of the genitals.
Hello everyone, welcome to my channel. Here is your doctor. So today we will learn about a very important topic from the nervous system. Before starting a video, if you are watching my video first time, then kindly subscribe my channel and like the video. So let's start. Neurosyphilis. Neurosyphilis is made up from the two terms, neuro related to nerve and the syphilis, a bacterial infection. Syphilis is a disease of sexual transmitted disease caused by Treponema pallidum. So, neurosyphilis is a bacterial infection of the brain or spinal cord. It usually occurs in people who have had untreated syphilis for many years. So, it is involve meninges, blood vessels and parenchyma of the brain and spinal cord. Now, look for the pathophysiology of the neurosyphilis. As we all know, neurosyphilis is caused by the untreated syphilis. So, within a days to week after initial infection, Treponema pallidum disseminated with the blood and lymphatics, the organism may accumulate in the perivascular space nearly any organs including the CNS. Now, we will look for the clinical features of the neurosyphilis. Neurosyphilis show three most common presentations. First one in the meningovascular means affect the blood vessels. Second one is the general paralysis and the third one is the taps dorsalis. Here we will discuss one by one. So, meningovascular causes endarteritis obliterans, meningeal exudate granuloma causes stroke, cranial nerve palsy, seizures and mass lesion. Second one is the general paralysis. Pathology is the degeneration in the cerebral cortex, cerebral atrophy and thickening of the meninges. So, this pathology causes dementia, tremors and bilateral upper motor signs. Third one is the tap dorsalis. Pathology is degeneration of sensory neurons, wasting of the dorsal column and optic atrophy. This pathology causes lightning pain, sensory ataxia, visual failure, abdominal crisis and incontinence. And most important symptom is Agrelli-Robertson pupil. Now look for the important investigation for the neurosyphilis. First one we will do screening for the syphilis. Second one is trypanomal antibodies detection. Firstly, we will confirm the person is affected by syphilis or not. Third one is the CSF examinations. What is the management for the neurosyphilis? Injection of the benzyl penicillin for 27 days in all type of neurosyphilis is recommended, and management of the case according to the pathology involvement. Thank you.
Application in medicine. Neurosífilis can be classified into early for asymptomatic syphilis, symptomatic meningitis, ocular syphilis, autosyphilis, and meningococcal syphilis. And late generalized paresis and tap dorsal. The early form of neurosyphilis occur in the first month and years after the first infection and after the meningitis and blood vessels. In the heart before penicillin used, approximately of people with asymptomatic neurosyphilis suffer from some of the symptomatic forms of the disease. After the discovery of penicillin have to die, the early forms of neurosyphilis are more common than the late one. Hard fears like intravenous administration of quartz crystalline penicillin G and doses intramuscular administration of procaine penicillin G and doses phase why penicillin allergy of their alternative include intravenous or intramuscular administration of cetrizone 2 gramos Hamdai, oral toxicity and high dose.
Neurosyphilis refers to infection of the central nervous system in a patient with syphilis. In the era of modern antibiotics, the majority of neurosyphilis cases have been reported in HIV-infected patients. Meningitis is the most common neurological presentation in early syphilis. Tertiary syphilis symptoms are exclusively neurosyphilis, though neurosyphilis may occur at any stage of infection. To diagnose neurosyphilis, patients undergo a lumbar puncture to obtain cerebrospinal fluid for analysis. The CSF is tested for antibodies for specific treponema pallidum antigens. The preferred test is the VDRL test, which is sometimes supplemented by fluorescent troponemal antibody absorption test. Historically, the disease was studied under the Tuskegee study, a notable example of unethical human experimentation. The study was done on approximately 400 African American men with untreated syphilis who were followed from 1932 to 1972 and compared to approximately 200 men without syphilis. The study began without informed consent of the subjects and was continued by the United States Public Health Service until 1972. Thank you for watching. Like and subscribe if you would like to view more of our videos. Have a nice day.
Not every word as syphilis develops the complication. Blood tests can be to detect substance produced by the bacteria that cause syphilis. The antibiotic penicillin used to treat neurosyphilis can be given of different ways. There is an effective, inexpensive, and accessible treatment. Visual problems. Every bleeding problems while eating, swear as confusion or lower concentration. Mental problems such as depression or irritability, loss of bladder control, incontinence. You will new follow of lumbar monitors for CFP analysis every 6 months. Many of these changes are not reversible. Continue to be a global public health problem due to the invasion rates are disorder year after year. It should apply in Ecuador. Syphilis has become a global public health problem with a prevalence of 1 million cases and 5.6 million new cases.
This is the portrait of a veteran who would fight again, if he could. No, he wasn't wounded. It wasn't an enemy shot that crippled him. It's not a wound of battle that makes him walk this way. Yet this soldier was crippled by the war. He was one of the tens of thousands of men who were mobilized. Away from home, away from friends, away from old habits, he was struck by an enemy in the blood, by a germ, the spirochete, the germ that causes syphilis. Syphilis that came and seemed to go away, but stayed in the blood to cripple him later on. This is the portrait of a veteran of World War I, a portrait of one of the thousands of soldiers taken from duty by syphilis, one of the thousands crippled, some killed, by the enemy in the blood.
Conclusion. In conclusion, late neurosyphilis was the most prevalent presentation, characterized mainly by neuropsychiatric manifestation. The importance of taking a detailed medical history in patients with neurological and psychiatric symptoms that do not correlate with other disease should be impatient. Thank you.